Hello healthcare professionals. Today I want to delve into how GAHAR standards improve patient education. Ensuring appropriate patient education materials is critical for enhancing patient understanding, engagement, and compliance with their healthcare. Let's break down the key steps, guided by GAHAR standards to ensure high-quality, patient-centered care. First, we have the assessment of patient needs. Education materials must be tailored to patient demographics, including literacy levels, age, cultural background, and language preferences. GAHAR emphasizes materials should cater to both high and low literacy levels to ensure understanding across all groups. Conduct surveys or collect demographic data to understand patient characteristics. Use readability assessment tools to ensure materials are easy to read, utilizing simple language and visuals to aid comprehension. Next, let's talk about the development and customization of materials. GAHAR mandates that patient education materials must be based on the latest clinical evidence and best practices. Involve healthcare professionals in developing content and review current guidelines to ensure materials reflect the most recent standards of care. Personalize education materials to be relevant to the patient's specific health condition and treatment plan. Create flexible templates that can be adapted to patient-specific conditions like diabetes or post-surgical care. Cultural sensitivity and inclusivity are also crucial. GAHAR standards emphasize education materials should respect cultural values, beliefs, and practices. Consult with cultural advisors to ensure content is appropriate and respectful. Partner with professional translation services to provide materials in the most commonly spoken languages and offer audio or video materials for patients who may not be literate. Next, consider the formats of educational materials. GAHAR suggests a variety of formats, including printed brochures, videos, and digital content to meet different learning styles. Develop a library of educational materials accessible both in healthcare facilities and online. Incorporate high-quality visuals to make complex information more understandable. Availability and accessibility are essential. GAHAR requires materials to be readily accessible at all points of care. Place educational materials in waiting areas and patient rooms. Ensure healthcare providers hand out and explain relevant materials during consultations. Partner with accessibility services to produce materials for patients with disabilities, using large print or audio recordings as needed. The involvement of healthcare providers is key. Patient education isn't just about handing out materials, it involves active participation from providers. Train healthcare providers to use educational materials effectively, explaining and clarifying content during appointments. Collaborate with educators to review and update materials based on feedback. Evaluation and continuous improvement are vital. Gather feedback from patients to ensure materials are helpful and easy to understand. Regularly update materials to reflect new treatments, technologies, and evidence-based practices. Establish a system for periodic review of educational content. Lastly, integrate with technology. GAHAR supports the inclusion of educational materials in electronic health systems. Upload materials onto patient portals, making them accessible after consultations or procedures. Provide electronic copies of materials during telemedicine appointments. In conclusion, ensuring appropriate patient education materials involves a comprehensive approach guided by GAHAR standards to improve patient understanding, compliance, and overall health outcomes. Thanks for watching, and remember to prioritize patient education in your practice. Stay informed, stay engaged, and keep making a difference.